Good morning. Good morning. This is Valerie Leonard. I am the founder of Nonprofit Utopia. I want to say thank you so much for joining us. We are talking about ways that we can develop a program logic model for your COVID-19 outreach. All too often we're so caught up in doing the outreach itself. We know that we've touched a number of people and we can't really, at the end of the day, justify how much of an impact that we've made. We know that we've touched people, but it takes more than telling people the number of people that you reached in order to demonstrate impact. So last week we talked about developing a theory of change where you can begin to think about some of the issues in the community and think of cause and effect in ways that you can actually make a difference. Today we're going to build on the theory of change and show you how to develop your logic models. And again, we're going to be using examples for COVID-19 outreach so that you can hit the ground running. I have a sneaky suspicion that there's going to be quite a bit of grant money coming down the pipe. So we may as well make sure that you're positioned to receive it. So you could talk about your work in terms of the impact and the outcomes and use the language that is, comfortable for the people who are actually giving the money. And before we get started, I would like for you, if you're here, to just indicate your name, where you're from. If you have any questions, let me know, and I will be sure to answer those questions just as soon as I go through the presentation. All right, so we're going to be talking about developing a program logic model for COVID-19. And this is for your outreach to make sure that you are demonstrating an impact. And before we do that, I want to tell you a little bit about Nonprofit Utopia. We are the ideal community for emerging nonprofit leaders. We have created a safe space where our members can innovate and share lessons learned and talk about issues of concern and not worry about having what they say go beyond our four walls, so to speak. And our mission is to develop the next generation of ethical nonprofit leaders. And we do that through community, we do it through coaching, as well as professional development and consulting. And our vision is to strengthen the global nonprofit sector by providing training for up to 50,000 ethical nonprofit leaders between now and 2033. And this live stream and other forums like it are one of the ways that we're doing it. If you have any questions, want to learn more, you can go to nonprofitutopia.com or join our community at nonprofitutopia.mn.co. And to give you a little bit of information about myself, I've been doing consulting since about 2003. And I've, over the years, have helped over 750 nonprofit professionals meet their goals and objectives. In fact, it's probably closer to 850 by now. And this includes helping them to secure over $100 million in grant funding. And this is through grant writing as well as technical assistance. And as I indicated before, I am the founder of Nonprofit Utopia, the ideal community for emerging nonprofit leaders. I wanted you to check us out at nonprofitutopia.com. We also do a podcast on Wednesdays from 3 o'clock to 4 o'clock on Blog Talk Radio, and I teach online courses as well. All right, so what I found in my work over the years that people are so busy doing the work that they don't really think about the logic behind it. They kind of have it in their head, but not on paper, and have a very difficult time sometimes presenting exactly what they do on paper. And I find that a really good way to do this is to work with the logic model. All right. So in the ideal sense, your logic model should be done, during your strategic planning process and right after your community needs assessment. So the logical order, and we don't always have the time to do things logically because of the time deadlines, and we don't always know things. So we kind of, when we know better, we do better. But in an ideal sense, you want to do your community needs assessment first, and then you want to do your theory of change, and we'll review that a little bit today. And then you want to do your logic model, and then you build your programs or your strategic plan from there. All right. So, what is exactly a theory of change? All right, it describes the process of planned social change. And bear with me because it occurred to me that you probably cannot see my screen. All right, so I'm going to share my slides with you. And I do apologize. Yes, Ramona. Yeah, ethical. That's very, very important to me. All right, so I'm going to share my screen so you can see what I see. Alrighty, so again, a theory of change, it describes a process of planned social change. And this includes the assumptions that we might make about the environment. And that can include a map of the process of change. So you might want to do a little diagram to show how the change should occur, the causes and effects. And when I say causes and effects, I'm talking about the causes of the problem and the effects that the problems have. And then you also want to be able to suggest interventions that will be proven to actually solve the problem. So basically, it's a blueprint for the work ahead, and it describes the likely impact, the impact of not doing anything as well as the impact of your work. And it also talks about when your work should be evaluated and how it should be evaluated. All right, and just as a refresher, if you were with us last week, we went over a sample theory of change as it relates to COVID-19. So the first question is, what is the problem you're trying to solve? All right, the problem is the spread of COVID-19 is uncontrolled. Students are behind in school due to school closings. People have lost their jobs as a result of shutdowns, and businesses struggle or have closed because of the slow economy. And who is your audience? Your audience is obviously the community stakeholder. And when we talk about audience this time, we're not necessarily just talking about people that we are communicating with and sharing a message. We are also talking about the target, the people that we want to impact. So we want to impact community stakeholders. We want to impact parents, students, and principals and teachers. We want to also impact unemployed community residents and local business owners and heads of nonprofits. And we're only going to be worried about this problem if it still exists. So basically, we're saying that we're in this for the long haul, and we're going to continue to address COVID-19 as long as it's a problem in our communities. And then our key audiences or our key targets, we're going to engage them if they're ready for change. And I can't imagine anybody this day and age that's not ready for change. I think we need to change our behaviors, but I do believe that everyone wants to see COVID-19 over and done. All right. So this column asks, what is your entry point to reaching your audience? In some cases, it might be at the homes. There are some brave souls who are actually going door to door, doing wellness checks and making sure people have food and all that good stuff. So it could be homes, it could be telephones. You can contact people through social media, bus and train stops. You can also, and that is, for in general, right? And then for the students and parents, and principals, you contact them at their homes, the schools, and that will probably be just a principal at that point, by telephone, social media, and bus and train stops. Now, when we want to reach the unemployed community residents, we again reach them through their homes, telephone, social media, and bus and train stops. And the same for local business owners. We're all pretty much contacting them the same way. And then we can only do this, and we're assuming that the outreach workers are willing to do this and that the stakeholders are receptive to whatever message, whatever programs and services we have. And then what are the steps that we need to bring about change? First of all, we need health education, sanctions, and rewards. And when I talk about sanctions, that should be some negative consequence as a result of not following the rules to keep everyone safe. All right. We also need computers and tutoring and parental support for our students. And then for people who are unemployed, we need to make sure that we're retooling them, giving them the job training that they need, giving them new job placements. And then the same thing for the business owners. Business owners are going to have to learn new skills. They're going to have to be able to adapt to the new environment. And this is going to require not only giving them funding, but giving them training to show them how they can adjust to the new normal. So we're assuming that there are some people in the community who are skilled to be outreach workers. So they'll either be trained or already have the skills. And these could include volunteers as well as paid professionals to go out and do outreach and make sure all of this happens. And it's going to take some coordination as well. And then the question becomes, what's the measurable effect of the work that's being done? All right. People practice safety and they're tested for tested and vaccinated for COVID-19. Students return to school. People return to work and learn new skills. And all of this stuff can be measured. The number of people who are actually doing this, right? And then this can only work if people in the community are compliant, meaning they're doing what you're asking them to do. They're working with you in your programs. And then what are the wider benefits of your work? The spread of the disease is slowed. Students go back to school. They resume learning. They make up for lost time. People who are unemployed, they find jobs, and then the businesses are stabilized. All right. And the only way this can work is all hands on deck, right? Everybody has to do his part. And then what is the long-term change you're looking for? So what's your long-term goal? You want to see healthy community residents make healthy choices. You want students to graduate and move to the next level of development, because right now a number of kids are out of school and they're not necessarily being engaged with the computer. You want to make sure that residents maintain or increase their savings, and they can't do that if they're not working, right? And then you want to make sure that the local economy is improved. And what that means is people in the community have jobs. That means that the businesses are thriving and the businesses can employ people in the community. All right. And again, you're assuming that all hands are on deck and everybody does his or her part, and it's not going to work otherwise. All right. So we're going to just talk about the situation analysis, and that's very similar to a community needs assessment. It's not quite as involved, but it would really be helpful if you do the community needs assessment. It gives you some of the highlights. All right. So a situation analysis is based on the needs assessment, as I said before. It describes the lay of the land, and it gives the context. And when I talk about context, I'm talking about the story. What's going on in that local community? How is that being impacted by other things beyond the community's control, right? What current events are happening? What are the issues? What are people grappling with on a day to day basis? All right, so this could be issues on the macro level. And when we talk about the macro level, we're talking about very big picture things. We're talking about what's happening with our federal government. So when we're talking about COVID-19, everybody's anticipating the stimulus package. They're anticipating stimulus checks, extension of benefits for unemployment. They're looking forward to the Biden plan where he's going to lose even more money and create a stimulus package. So he's got at least two plans going on simultaneously. He's got, to the best of my knowledge, two. He may have even more, but he's got a COVID-19 plan, and he also is negotiating with Congress to get the $900 billion stimulus package going. So that's one of the things that's going on at the macro level. When we look at what's going on at the micro level, we're looking at what's happening with our own organizations, and then somewhere between our own organizations and what's going on at the federal level, we have what's going on at the state level, we've got what's going on at the county level, what's going on at the city level, and what's going on in our community. So we've got to be cognizant of all of that, because all of that impacts our work, whether we're aware of it or not. So we got to know who the major players are. We got to know the latest developments, and we have to know the impact of all of this, not only on our organizations, but most importantly, how is it impacting the people that we serve? And that's most important, because we have to develop mechanisms that will work for them and will be proven by data that we made a difference, right? So one way to do that, after you've gone through your theory of change, after you've done your situation analysis, then you work on your program logic model. So this is a very, very simplified version. It could be as simple as this, or it could be very, very complex, with a flow chart with hundreds of boxes. And I'm saying that to exaggerate, but I have seen, very complicated program logic models, but they all boil down to one thing. What is it that you need to to make a difference, to meet your goals? What is it that you're going to be doing, and what is the change going to make? So in short, a program logic model is a diagram that shows, it gives you an overview of the situation. It also outlines the major goals and activities, the resources required to operate the program, the activities that are required to meet the goals, and the desired change that you want to see as a result of engaging in all of those activities, or what we call program implementation. So remember, you got the program planning section, and then when you're actually doing the program, that's called implementation. And as I said before, there are many, many variations, many ways you can do it, but they all require what resources you're going to have, or your inputs, your outputs, or your activities, and your outcomes and your desired changes. All right. So when we talk about goals are a very general, broad, sweeping description of what it is that we want to see happen as a result of our work, right? So whenever you're establishing goals and objectives, whatever they are, I'm assuming that your COVID-19 work is in alignment with your organization's strategic plan, mission and vision, and goals, right? So you got to make sure that whatever your goals are for this work with COVID-19 are in alignment with what your organization's stated mission, vision, and goals are. You want to make sure too that your goal is more outcome oriented versus process oriented. And the reason why I say that is because you want to make sure that your goal is not to do more work, right? And more productivity. Your goal is to actually make a change. So if you were focused on goals of process, for example, my goal is to serve 100 people. My goal is to train 100 people. That's well and good. Those are process goals or objectives. Your But if you meet all of those with no intentionality of change, no intentionality of impact, then you can meet those goals and you can never ever begin to make any change as it relates to COVID-19. So your goal is going to be something that will show that you are making some headway towards eliminating COVID-19 in your communities. All right, so here is an example. This is not a COVID-19 example, but here is an example nonetheless. It's SMART, which means it's specific, it's measurable, it's achievable. And achievable, it may vary based on what your organization is capable of doing, but something that is within the reach of your organization doing, achievable. It's realistic, again, realistic for the resources that you have, and it's timely. So you want to put a deadline on the action. So in this example, there will be a 5% decrease in the number of freshmen who drop out of high school within the first year of the after-school program. All right, so now we're going to talk about objectives and key indicators. So your objectives are the way you're going to achieve your goals. So your goals very broadly talk about what you're going to do, and your objectives tell you how you're going to do it. And you have outcome objectives and you have process objectives. Your outcome objectives are more focused on what will change. Your process objectives are more concerned with how you're going to do it, or the nuts and bolts, right, of how you're going to do it. And you really need both. You can't just have one or the other. So an outcome objective is a measurable, time-specific result that the organization expects to accomplish during a certain period of time. So if you're responding to a proposal, so you want to have goals and objectives that are within the time frame that money is being given to you. All right, so that's one example. Sometimes you might want to have it accomplished within a year, or 2 years, or whatever. So in this case, there will be a 5% decrease in the number of frail older adults going into convalescent homes during the first year of the social service referral programs. So this talks about how you're going to do it. How you're going to do it by by making sure that there's a reduction in the number of people going into convalescent homes. All right, so this is demonstrating a result and impact. And then another objective that you might have that will be a process, that helps you get that result, right, is there will be an increase in social service referrals and follow-up for 75% of the individuals served by the Meals Consortium during the 2000-2001 year. So this is how you're going to do it. So the outcome objective is telling you what's going to happen, what change you want to see in the lives of your clients. And the process is telling you what nuts and bolts activities you're going to do in order to make that happen. So you want to reduce the number of people going into convalescent homes. And how are you going to do it? You're going to increase social service referrals so that they can get service at home rather than going out to a convalescent home. All right. So after you do that, you want to make sure that you have key indicators that will help you measure your progress towards your goals and objectives. So in this example, again, keeping consistent with the frail elderly program, the Meals on Wheels program, we're going to say the number of frail adults or the number of referrals provided by the program. So you will know whether or not you're moving towards your goal of reducing the number of people who are frail and elderly going into convalescent homes by measuring the number of people who are actually going into those homes, right? And hopefully over time, the number of people will decrease as a direct result of what you're doing. So I'm going to share with you an example program logic model for a prisoner reentry program. And then after that, I'll share with you an example from COVID-19. So in this example, you first need to look at what's going on in the community. So you assess the needs in the community. And when you do that, you want to consider how many ex-offenders are returning to the community on a weekly basis, on a monthly basis, or even an annual basis. So you want to quantify this problem, right? And then after you quantify the number of people who are coming back, you also want to look at the impact that their coming home, so to speak, to has on people in the community. How are they impacting their families? How are they impacting the people on the block? All right. How are they impacting the people that they victimized before going to prison? And then you want to look at the prisoners. What problems do they face? Right? They might have problems with housing, problems with education, may need to get their GED. Obviously, they're going to need a job, right? And the list just goes on and on. And then what is it that they actually need in order to make that transition, right? So you're going to find all that out through the research. You're going to do literature reviews, interviews, and focus groups. And when you want to find out the problems they face, you can do that through surveys, interviews, and literature reviews. And then you can talk to family members to find out exactly how they're impacted. All right. And then you want to know what services are available to them. And you can do that through asset mapping or a review of public documents. And then you also want to know how well those services work, right? So you can get that information through surveys, through interviews, and focus groups. And then you also want to know if there are any gaps. And 9 times out of 10, there's going to be gaps in services. I don't care how many nonprofits, how many churches you have. Somewhere there's going to be an untapped need, a need that's not being met. And after you go through the research, you'll be able to identify what the gaps in services are. And then you'll ask yourself, how can our organization fill in those gaps? And that's through strategic planning, program planning, etc. Right? And you'll do that same process for your COVID-19 outreach. So here is my favorite program logic model. The reason why I like this is it's simple, but it also lets us look at our goals and objectives and the evaluation up front. You know, all too often when we're doing our work, we don't think about the evaluation until it's finished, and we might not necessarily structure the work that we're doing in our day-to-day activities in a way that we can actually have a successful evaluation. So the Discipline in this model is it forces you to think about the end at the beginning. All right. So once you look at the community, do your community needs assessment, do your theory of change, do your situation analysis, you set your goals and objectives. What is it in the community? What's happening in the community? And as a result, what are the goals and objectives? And those goals and objectives, again, they need to be grounded in reality. They need to be smart, right? They need to address the needs in the community, but they also need to be goals and objectives that your organization has the capacity to address. And with something as large as COVID-19 and complex as those issues are, you're going to definitely need other partners. So the first thing you do is your situation analysis. You're looking at the macro, which is the big picture. What's happening on the national level? What's happening with policy, right? What are some of the latest developments at the national level? And then when we do micro, we're looking at local. That could be city, it could be state or county, but it always includes your local community, what's happening with your organization and your clients. So micro is those little picture things that are close to you, and macro is the big picture, but you need to have both when you look at your situation. And then you look at your inputs. One way to look at that is not only what resources, you might look at what it is we invest. What do we have already? And if we don't have it, what do we need to get? What do we acquire? So what we invest, if we have any excess funds, and that's very rare in this environment, but if your organization is blessed enough to have money, then you invest your money, you invest your staff time, you invest volunteer time, you invest your equipment, you invest your supplies. All of these are going to be used in your fight to reduce COVID-19 in your community. And then what is it that we acquire? 9 times out of 10, you're going to have to get more money, right? You're going to need additional staff. So if there's funding to hire an additional person, then you do that. If you need to get volunteers, you do that. You acquire expertise. You get that through ongoing professional development, training that you're going to need in order to effectively fight COVID-19 in your community. And then when we look at who we reach, who is it that we're trying to reach? Are we going to focus our effort on seniors? Are we going to focus our effort on school children? Are we going to focus our effort on people with disabilities? Are we going to focus our effort on the homeless population? So we need to be really clear about who it is that we're serving. And then we need to look at what we're going to do. Are we going to do programs? Are we going to do services? Are we going to do both? And the difference between a program and a service is a service we know is being done for the good of the community, is being done for the good of our clients, but there's no intentionality necessarily around change. A program, on the other hand, is very intentional. It has goals, it has objectives, it has specific outcomes, and it has measures, right? And I would say a good example for this would be a soup kitchen versus a diet. A soup kitchen we know is very good for us, right? Hopefully they're passing out food that's very, very healthy. But to the best of my knowledge, most food pantries only collect the names, addresses, and zip codes of the people that they're serving. So they don't know if there's any positive change that's been made. They can make assumptions, but they don't really know. They just know who came through and where they live. However, when you're doing a diet program with the goal of, say, losing weight, goal of reducing blood pressure, goal of reducing diabetes in an effort to reducing blood sugar in an effort to prevent diabetes or control diabetes, then you have some very specific goals, very specific measures. You can take your blood pressure over time, see how it changes, and all of that stuff. The same with the diet. If you're trying to lose weight, you can measure your weight over time, and then hopefully you hit your targets with your sugar levels and with your weight. Okay, so if there are any questions, please feel free to post and I'll respond to those afterwards. But that's the difference between a program and a service. And that's the difference between your COVID-19 outreach, where you're just knocking on doors, handing out food. And God knows our neighbors need food, they need protective equipment and all that good stuff. But if that's all you're doing, if you want to get to the point where you're creating a program where you're actually making a difference, then you're going to have to go beyond just the service part where you're handing out, handing out resources and only taking down names as to where you distribute it. You have to be very intentional with your goals and objectives. Hopefully, the goals would be to bring down the incidence of COVID-19 within a specific time frame. All right, so the next thing is to focus on outcomes. How will our clients be impacted by our work? What's going to happen for them in the short term? What's going to happen for them in the intermediate term, which is midterm? What's going to happen to them in the long term? And then you have to figure out how you're going to evaluate it. How do you know that you're going to be successful? And all of this too, we have to know how we're going to measure it. We have to know what data we're going to collect so that we can substantiate or prove that what we're doing is working. So in order to do that, you're going to have to take an assessment of what's going on before you start, and then you do an assessment with the same group of people in the same geography, same community, and you see if there's any difference. And you have to narrow it down to those specific people that you're serving so you can be clear that what you did made the difference. So here is a sample mentoring program logic model, and you may have seen this before. The goal is to reduce the rate of recidivism among clients in the Second Chance Act funded programs by 50% over the next 50 years. The research has shown that one of the best ways to reduce recidivism is to make sure that ex-prisoners have mentoring and they have jobs and they have supports. Right. So this column is, we're looking at the situation, and I'm not going to read all of this, but for example, over 650,000 inmates are released every year in the United States, and they return to their families and community. And without intervention, 40% will go back to jail. All right. And then we found that in 2001, 18,000 came back to Cook County, right? So that meant, and of those people, 15,000 who were released into Cook County, over 84% came to the city of Chicago. And as you know, more than, most of those people are in 6 different zip codes. And we also know that the Second Chance Act was passed in April 2008 and is still in effect. And when we look at what it is that we need to hire a case manager. We need to also buy software so that we can track our programs. We need to train people, train our staff, and develop pre-release orientation for the people who are coming into our program. And we need to make sure that they're matching funds. I said I wasn't going to read all of this, but I think I do need to. The outputs, so what are the activities we're engaging in? Our target is nonviolent offenders who are 18 years and older, and they had to have been released within the past 6 months. We're going to provide case management and mentoring programs. We're going to provide job training and placement, and we're going to make referrals for them. So, what do we want to see happen as a result of all this activity? We want to see our clients securing employment, and the measure of that is the number of clients who actually get a job. We also want to see that our clients get a consistent work history. And how do we know that? We look at the number of clients who remain employed. When we look at an outcome of living wages, we want to make sure they have enough money to support themselves. One way to tell whether or not we made that is to look at the average earnings of the people we're dealing with. And then the next is we want to increase public safety. We want to make sure that they don't recidivate. We want to give them an environment where they don't feel tempted to engage in criminal activity. So we look at the rates of recidivism among the people that are working with us. So when we're evaluating, we want to ask this question up front, before we do any work, right? What's the power of the mentorship model to reduce recidivism? If it's working, if mentorship is really one of the determinants that keeps people from recidivating or going back to jail, what is it that we expect to see, right? And then what data are we going to collect as we do our program so that we're not scrambling when we're doing it? So if you do an intake process, you want to create your registration materials that'll collect a lot of that information for you up front. And then you do the assessment, using those same forms afterwards to help you see if there's been any change as well. And then you'll also administer surveys and other tests to measure their change. All right. And that's how you develop what we call an evidence-based program. Now, this last chart, this is an example of how you can at least get started developing a logic model for COVID-19, right? It's not quite as detailed, even though it might have more words. It doesn't have quite as much information as the other one. And when we come back again on Thursday, I'll make sure that I can add some stuff to it that will make it even stronger. All right, so in this example, this is not a real program, but for example, if you're on the west side of Chicago, in North Lawndale or South Lawndale, this might be helpful for you. Our goal is to reduce the spread of COVID-19 in the 60623 zip code by 20% within 6 months. So when we talk about the situation, we'll note things like there were 70,000 people tested for COVID-19 as of January 31st, and about 14% of them were positive compared to 6% for the state of Illinois. Schools have closed, businesses have closed, people are losing jobs, people are not socially distancing as much as they should. There's a shortage of vaccinations, shortage of protective equipment. People don't trust vaccines. President Biden has a national plan for COVID-19 that will help us address these issues on a national level and also make sure that there are resources trickling down to the community level. And he also passed he's working on a $900 billion stimulus package and negotiating that in Congress. So inputs, those are some of the resources. And this is not a complete list, but, in order to bring down the spread of COVID-19, we're going to need hospitals, we're going to need community organizations, we're going to need program coordinators, outreach workers, volunteers, contact tracers, medical personnel, grant funding, and I'm sure you can think of more resources, right? When we look at the activities we're engaged in, we're going to be engaged in contact tracing, testing, vaccination, education, community outreach, marketing programs, town hall meetings, canvassing, going door to door, training for small businesses and training for nonprofits to make sure that they can adjust their ways of providing goods and services and programs, provide small business loans to nonprofits as well as for-profit businesses, provide technical assistance to share with people ways that they can make their pivot, make adjustments in their business so that they can survive COVID-19. So what are some of the outcomes? What do we expect to see change? We expect that all community residents will engage in safe behaviors, and one way to measure that is by observation. That's what we call empirical analysis. Another way is to do surveys of the people that you're working with, get a sense for whether or not they're in compliance before you work with them. And then after your program is done, get a sense for how many people who were not engaging in safe behaviors are now engaging in safe behaviors. Another thing is we're expecting that people won't be afraid to be vaccinated. So again, you will look at how many people are being vaccinated now before there's intensive education versus how many people are actually vaccinated after your program. Small businesses will adjust their business models to adapt to a new normal. And again, how do you do this? You do a pre-test, you do technical assistance, and then hopefully after the technical assistance and training, then you want to see that they're changing their business models. And the same for small businesses. All right. So here is a comment from Ramona. Ramona, if you're still there, thank you so much. Your comment is, we want our communities to be more adaptable and resilient to absorb shocks such as COVID-19. I hear you, and it's going to take all hands on deck. I'm going to show you when we come back on Thursday how to pull together a collaboration of organizations in the community so that you can do that. Alrighty. Apparently this is in relationship. Yeah, Ramona had a question. Apparently I said something that clarified a point. And then Ramona, do you recommend developing a theory of change for each program? Your theory of change is not for each program. Your theory of change is for the community. So you're looking at the community, you're looking at the issues in the community, you're looking at what the problems are, who's impacted, and what some of the ways you can address those issues. So that's more of a macro thing. And then you develop your own program. Every strategy that you need to develop has to be hopefully responsive to that theory of change. Every program, every logic model is going to be developed in response to that theory of change. All right. Are there any more questions? And thank you so much for asking that, Ramona. Any more questions? All right. I just want to say thank you guys so much for joining me today. We're going to be back Thursday, February 4th at 10 o'clock. We're going to show you how to develop a collective impact model, for addressing COVID-19. All right. Um, thank you, Leslie. Thank you for soldiering to the end. Thank you. I appreciate the feedback. Any more questions? Any more feedback before I go? All right. I want to say thank you so much. And we will be storing this on our YouTube channel. Take care. Bye-bye.